Hello and welcome to week 3 of your knee pain questions answered. I want to apologize for the video on week 2. I'm still working on the technical aspect of getting this information across to you. It looked like you were looking through a submarine periscope. So anyhow, hopefully as I get the kinks worked out, the information will come across clearer and better and everyone will be happy. So, I have some questions this week that I wanted to go over. The first one is, hello Bill, just signed up to your site and saw some videos. I had surgery, ACL reconstruction, and meniscus damage 11 months ago. No problems running. I can run quite fast and then stop, accelerate, no problem, of course, after running for a while and warming up. I love football, and even my doctor told me to start playing gradually. After 7 months, I didn't let the knee rest for a couple months more. Let the knee rest a couple months more to be on the safe side. When I kick the ball, just from the side with my foot, I have pain on the inside of the knee and the lateral ligament, I think. It lasts for a few days, and then it's okay, but when I go back after the pain is gone, and he lets it rest for a week, I kick the ball with my foot from the side, starts to hurt again. That doesn't happen if I kick the ball with the front upper part of my foot, since in that case my knee is not bending aside. Hope this makes sense and really appreciate your time. Regards, Gabriel. Gabriel, thank you very much for your question. This is a part that I go over a lot in my book. It looks like the tendons on the inside of your knee are a little bit weaker than the tendons on the outside of your knee. And it's very important that you get those strengthened. And I have, in my book, Stop Your Knee Pain Now, I have exercises that really target these areas that can really help you out as far as strengthening those tendons and ligaments in your knee. That's really what's most important. You can work on the muscles all you want, however, until you get past the muscles and work on the tendons and ligaments in the knee, there's a tendency not for the knee joint to be supported like it needs to be. And that, like I said, that's in the book. Shameless self-promotion. Anyhow. Okay, Gabriel, if that does not answer your question, please email me back and I'll be more than happy to clarify. I do believe, though, check on my website, thekneepainguru.com, and I have one of those exercises called the Roman chair, and that will help with this as well. So buy my knee book, check out the video, or do both. So anyhow, thank you. The next one is from, it says, hi Bill, I have a question that I visited, I have a question. I visited my orthopedic surgeon. He says, I have arthritis in my leg. Can you suggest me any good herbs that can help my knee pain? He said that it is moderate pain, so nothing to worry about, but I do worry and would like to cure it completely. Okay. I believe addressing your knee pain is a process. It's a journey, not a destination. So in terms of curing your knee pain, you know, that is, like I said, that's a journey, not a destination. You need to work at something to make sure that it doesn't come back, rather than having to think that there's one thing you're going to take or one thing that you're going to do that's going to resolve all of your issues. So, I would, from my perspective, and what the research that I've done regarding arthritis, the best thing you can do is begin to drink more water, because you go back into the pH level in the knee itself, and whether it's acidic or alkaline, and when that acidic, when you have a lack of water in the body, your body's dehydrated, that it creates an acidic state in your joint. And especially if you have an injury, that's going to be an area where that acidic state is going to sit more. So if you don't drink enough water, you're not hydrating yourself enough, you don't have enough water for your body to flush out all of those toxins that have built up in your knee, creating the acidic state, irritating the nerve endings, sending a signal to your brain that you have knee pain. So I believe increasing your water intake is going to help. And once again, some good exercises. If you're experiencing pain, and like I said, I go through I have just a ton of exercises in my book, and I really believe it'd be beneficial for you to buy my book and start doing those exercises. It only takes a few minutes a day. When you're building tendons and ligaments in the knee, you're only talking about 11 minutes a day is what I'm suggesting in terms of those exercises to be able to help you build the tendons and ligaments in your knee to support the knee, eliminating your knee pain. And that was from MASH. I have one more question. How can I rehab a knee that has been injured by falling on it multiple times? That was from Margaret. Margaret, thank you for your question. It's important to understand, and this is of course if you've already cleared it with your doctor. If you've fallen on your knee and you've had the x-rays and the MRIs and the doctors are saying there is nothing torn or broken, and that's very important, and I'll repeat that again, that if you've fallen, you want to make sure that there is nothing torn or broken first. So if you do go ahead and do any rehab, that you're not exacerbating or making a situation worse because of the exercises that you're doing. So that is key. That's kind of a foundation before you start going forward with rehab. The second piece to that is the exercises that you do. If you're not doing the proper exercises that are strengthening what's inside of your knee, and those are the tendons and the ligaments that hold your knee in place, then it's going to be difficult for the knee to have the support it needs in order to be able to heal. And again, I touch on that in my book, Stop Your Knee Pain Now, that the exercises that you do have to fatigue the muscles. Your muscles fatigue after 7 seconds. So fatigue the muscles, then all you have left to work with are the tendons and the ligaments. And that's where the real work begins. You get the muscles out of the way. That's a figure of speech. Get them out of the way so you can really do the work. The knee can do the work that it needs to in order to be able to strengthen the way it needs to be strengthened. So, I hope that answers your question. I'm going to leave a link to the left of this video that will go straight to my ebook, that you can go ahead and purchase that. And believe me, once again, there's a 100% money back guarantee. If the exercises aren't working for you, if you don't benefit from that book, I'm taking all the risk away, I'll refund your money. It's not a problem, because I really want to help people get better. I was in the same situation myself as Gabriel in the beginning of the video. Beginning of this video, I had ACL reconstruction and meniscus damage. I tore the ligament in my knee, and these were the exercises that I did to help me get over that. So I want to share it with you, and I wanted to help you so you aren't walking around with knee pain, because there's a whole host of other issues that I haven't even gotten into yet that I will in future videos, talking about all of the different things that happen as a result of you walking around compensating for your knee. So, go buy my book, and I will see you next week. We're going to be doing this on Wednesday and Thursday, and hopefully I've gotten all the glitches out of the video piece so you won't have any difficulty understanding me or seeing me. Thank you very much, and I'll talk to you next week. Bye-bye.